Hello, everyone. Your mentor is back again with another introduction to start MRCOG Part 2 in a focused manner. Is my voice audible and clear to all of you out there? Can you all hear me, please? Loud and clear? Is it? Thank you very much. That's perfect. Very warm welcome to all the students joining in for the discussion today from the entire team of RFA tutors. I have a pleasure to be with you guys again. Thank you so much for joining in. And warm welcome from the entire team to all of you out there. Okay, so we are here today to have a discussion on how to prepare this MRCOG Part 2. All of you are not blank. I very well know that. Specifically, those who are in the study group are well aware about the facts. But I'm going to tell you as a student how to read a guideline, how to make notes. So this is going to be the agenda for today. Thank you very much, Vani. Thank you, Harshita. Thank you, Prachi. Thank you, Ax. All of you. Really happy to see you all. Thank you so much. And I hope students are joining in. Write in the study group that we are starting. Sadia, Prachi, my dear, somebody please write in the study group that we have started. If they're missing out the times, they should not miss out the live session. Thank you so much. Walaikum assalam, Sadia. Thank you so much, my dear. They say that every day is a chance to begin again. And we don't have to focus on the failures of yesterday. We have to start today with the positive thoughts and expectations. This is what my belief is, and this is what I want to inculcate in you guys to begin with. Let's have a brief introduction of MRCOG Part 2 so that when we start, we exactly know what is our aim. With this optimism and positivity, let's learn the curriculum and the exam pattern of MRCOG Part 2. Now, you have to tell me that when you were taking MRCOG Part 1, what was the pattern of exam? We had single best answers. Did we have any extended match questions there in MRCOG Part 1? Did we solve any extended match question? Tabinda notes it's perfectly, Tabinda, right? We had only single best answers, right? So what is this transition and this change of pattern of study from MRCOG Part 1 to MRCOG Part 2? We have got the exam, which contains 2 papers, same as that of MRCOG Part 1, but here we have single best answers and the extended match questions. Undoubtedly, these extended match questions are challenging for students. Unfortunately, the students who are not able to make this exam in one go, they're always saying that, ma'am, I was having trouble in the EMQ. What does it mean? We need to learn from seniors' experience, right? If you talk about me, I used to stress upon the extended match question more than that of the single best answer. To begin with, it has to be clear that single best answers and extended match questions both are there. However, we have to practice EMQs more from the very start. Our emphasis should be on EMQ because generally the single best answers, students, they find it easy. They make it simpler because of the practice more, but EMQs are closer to each other. They're very, very close options and they require more practice. That is point number 1. Now, you all need to understand that single best answers and extended match questions, both of them are like 50 plus 50 in one exam. For example, it's a gynecology paper, 50 single best answers and 50 extended match questions. Friends, is my voice clear? Vani, Harshita, everyone, please, the voice is clear? Yes? Please give me a thumbs up. Okay, thank you very much. That's lovely. Thank you, Sarah. Thank you. I hope Malta is doing great. Thank you. It's really great seeing you all over the world. Thank you so much. Okay, then we have extended match questions. These are 50 extended match questions. So in each paper, we have got 50 single best answers and 50 extended match question. Then we have a break. And then again, the next paper, next exam, again is 50 single best answers and 50 extended match questions. So to begin with, you all should be clear with this, that we need more attention and more practice towards the extended match question because they require more practice in terms of getting the gist of it And speed has to be better as well, because there are lots of options starting from A going till O. Lots of books are available in the study group. You people are going to practice from the very start. And I'll tell you exactly that how you have to rule out and perform the exclusion while doing the extended match question. So this is about the exam pattern. I hope you people are clear about the exam pattern. Did you people understand what the exam pattern is? Yes, right? So 2 papers, 100 questions each, 50 single best answers, 50 extended match questions, right? This is what we are going to practice. This is what we are going to have our aim to be successful in. All right. Okay, Harshita, right? Thank you very much, Ax. Okay. Now coming to the curriculum. When it comes to the curriculum, we have got the distribution of various guidelines. However, 70% of the curriculum that revolves around the Green Top Guideline. Walaikum assalam, Shabana. Thank you very much, my dear. Green Top Guidelines make the bulk of your curriculum. That's undoubtedly the most important part. No matter now talks are coming more, we all are putting an emphasis and stress upon reading the talk articles, but definitely cannot take the Green Top Guidelines place at all, right? So when we are, please have any questions each paper. Idam Majid, my dear, 100 questions each, obstetrics and gynecology. I'm going to take all the questions, Idam, in the end as well, okay? Don't worry, please. In the end, I'm going to take all the questions. So 50 single best answers plus 50 extended match question, Idam, in paper 1, 50 single best answers and 50 extended match questions in paper 2. Got it? And in between the paper, we have got a break. Right, Idam? Got it, my dear? 2 papers, 50 plus 50. Got it? Okay, lovely. Thank you. Now we are coming to the preparation. In the preparation, 70% of the curriculum is done when we cover the Green Top Guidelines. And the Green Top Guidelines, we have to read first. We have to make our notes, which I shall teach you today. And we have to know the stepwise protocols specifically for the extended match questions from the recommendations. I don't want you to get overwhelmed by the percentages, but I don't want you to ignore at the same time. So I'll tell you what you have to do from the percentages, how to memorize, how to make the good notes from the percentages. The recommendations have to be on fingertips. I cannot excuse any of my students who doesn't know that what does the recommendation say. There is a chance that we might not be able to answer some question which is from the paragraph, some tiny line in the Green Top Guideline. It's okay, we can forget. But from the recommendations, if something is asked, that has to be like, you know, so quick on our spinal reflex, and there should not be any ambiguity on that. So the Green Top Guideline recommendations should be on your tips, answering any question. You should tell me immediately, yes, ma'am, Green Top Guideline number 5 says this. Green Top Guideline 37A says this, 37B says this. Green Top Guideline has to be on our spinal reflex. The only way to learn the Green Top Guidelines is you learn the new ones and you give half an hour to your older notes. That's the only way we can make our memory better. You've got your daily schedule. You people are starting and you people are wonderfully doing quiz. You people are wonderfully having discussions, and then you're going to have my live sessions. So these multiple revisions, that sets on a sort of a basal memory. And this memory is going to be used when we are going to sit in our exam, even the long-term memory that works. So when you're doing your guideline daily, as per your daily schedule, you are performing the task number 1. When you are doing a quiz, that is basically a brainstorming. You go back to the guideline. Oh, I missed that question. What was this question all about? And you learn that recommendation again. When you listen to me in the live session, you open up your notes and say, okay, ma'am is saying that this is an exam question. This is how the question comes. You again highlight that, and that is going to be part of your good registered memory, and that's going to be part of your neurons. Do you people understand that how the Green Top Guideline from multiple sources in multiple revisions you have to do? And after 2 months, you people would be having a schedule where you people will do the new ones, but give 30 minutes to the older ones. This is the only way the curriculum is going to be at par, and we are going to have a better memory to reproduce that on the day of exam. Therefore, Green Top Guideline has to be the first priority in the preparation. So Maya, my dear, I'm going to take all these questions in the end, right? Okay, about the solving questions. All right. Second in priority is the NICE guideline. Definitely, yes, each line is very important. And it's important that NICE guideline recommendations you have to do. You can leave the audit and the research part, which is in the end. That can be ignored, right? And in the end, you should be knowing that there are certain topics which are in the NICE guideline, which you don't have anywhere else. For example, the labor, the intrapartum NICE. For example, the preterm, subfertility. We don't have anything, and we have to do it from the NICE guideline because we don't have any other recommendations or any other source for this to cover up. Therefore, those guidelines which are only covered by the NICE guideline, that has to be well versed because the questions come from that part, and we don't have, especially in the obstetrics paper, the NICE intrapartum is very important. You have been doing it in your MRCOG part 1 as well. You all know the CTG questions, the instrument questions, but here the standard and the difficulty level is going to be a little higher because the scenario-based questions are quite difficult as compared to MRCOG part 1. So you need to have a very good understanding about the labor intrapartum, about the subfertility, about the preterm labor as well. Coming to the obstetrics and gynecology articles. The talk articles, when we used to take our exam, believe me, they were not very important. I mean, we do the last 3 years and the job is done. So it was not something which was like, you know, creating some sort of a chaos among students. But now the thing is that, thank you very much, Ira, my dear. All right, so now the thing, Jyoti, I'm going to take all the questions, my dear. If I'll be just breaking up the tempo in between, you people would not be understanding the gist, sweetheart. Do you get that? Yes, I'm definitely going to take all the questions. Keep on writing them. When I'll open up the question and answers, we are going to discuss everything out there, okay? All right. Now, the talks, we have a huge list. The question is that how to cover the talks. You just have to cover the daily schedule. The schedule does not skip even a single talk or even a single scientific impact paper, which you people have to cover, right? When you people are doing the talk articles, you people have to understand that the talk articles are important for a single best answer. They're important for what? Extended match question doesn't come. What comes from the talk article generally? Single best answers, right? In the single best answers, you people have to remember the talk CPDs. They are very, very important. And Harshita, in single best answer, they give you the exact gist or the line or the tables, the algorithms of the talk article. It tends to come in exam. So what is important? It's must to do the last 3 years, right? Last 3 years. The topics not covered by the Green Top guidelines, right? It's important that you do the single best answers from reading each talk article. You read it in a manner that the single best answers, you are able to pick it up. Again, I would like to say that its priority is not that you keep on reading the talk articles and you skip the Green Top guideline. I mean to say that students, they get stressed up so much. Jyoti, students, they get stressed up so much that they start doing the talks and they have not completed on priority their Green Top guidelines. Do you get that? Jyoti, my dear? If at all you're reaching to the talk article, you should be knowing that what percentage it is going to make. It would definitely be third in priority after Green Top guideline, my dear. After NICE guideline, the talk article would be important, but it would be third in priority. So in curriculum of MRCOG part 2, the first thing you people need to understand is to give the due importance to what you're reading. To give the due importance, what it's going to come in form of percentage in exam. It's not that we leave the Green Top guidelines and we start picking up the talks. It's not that we leave the labor interpartum and we start picking up the talks, but yes, we cannot leave talks because now the trend is changing and the talk questions definitely are coming more as compared to the previous exams, right? But they're very typical questions. One or two odd questions from smoking talk article, or for that matter, electro-cautery. Yes, they were in the last few exams, but it does not mean that they're going to, make your decision for the passing or failing. So the bulk of the exam still remains from the Green Top guideline. The bulk still remains from the NICE. In addition to that, we have to do the last 3 years talks, and those talks which are not covered by the Green Top guideline or the NICE guideline, those would be covered by these talks, and that all would be in your daily schedule. You don't have to search or scrutinize yourself. They've already been in the sequence of the module-wise study, and you have already been given by the details of the daily schedule, right? Only those talks have to be done. Now, after this, we do have certain curriculum parts in which we have the Faculty of Sexual and Reproductive Health. You all know that it's a big recommendations and guidelines. We don't have to do those 100+ pages. Only the guideline summaries on the website are sufficient for FSRH. When I will cover the contraception and sexual health module, you people would understand the tables and the recommendations, they suffice. And you need not go into the details because that is one module. And we get around 12 questions maximum from this sexual health, including the BASH as well. So we've got the British Association for Sexual Health and HIV. My summaries and tables, again, for this is sufficient. You don't need to go into details, but BASH summaries folder is absolutely sufficient because FSRH and BASH, it comes into one module as per the curriculum of MRCOG-2, also for MRCOG-3. Pranita, my dear, the study schedule is in the group. You've just joined at 30 minutes back, sweetheart. I'll just tag you after the session in the study group, right? It's in the announcement section. Safa, actually, she just joined 30 minutes back, my dear. Yeah, so I'm just going to, Safa will tag you, my dear, no worries, okay? All right. Then we have got the scientific impact papers. We've got the mother and baby reducing risk through audits and clinical governance. Consent advice is also there, and we've got NHS cervical screening program year 2020 we are following. For all these, the summaries are sufficient. For NHS cervical screening program, my algorithm would be sufficient. Clinical governance, 2 sessions already Safa has distributed for you guys, and all the details are there, so you don't need to worry about that. In simple words, if you follow the daily schedule, your curriculum would be done. And I know that you people are thinking that our daily schedule, that is going till November. So the thing is that after 3 months, the revision would start. So that revision would be from the start of the daily schedule, but you'll continue your first read of the obstetrics, right? Because by that time, we actually analyze that students' tempo has been made. They have really understood that how to study. The Faculty of Sexual and Reproductive Health, FSRH, USTRA, my dear, the contraception guidelines we had, the emergency contraception, the UK MEC, yeah? There's a list on your website, USTRA. Okay? Yeah, these are the contraception guidelines. Okay? All right. Now, you must have realized being in the study group that from the very start, we are emphasizing on practicing. You read a guideline and you're not able to answer the questions. We basically are lacking some there. For the last 4 to 5 years experience, I would like to tell you that students, they keep on reading. They keep on reading the Green Top guideline. They keep on reading the NICE guidelines. But when it comes to question solving, they don't understand and what are they asking? So whenever you are reading a guideline, you have to assess yourself. So that only comes by question practicing. We've got a long list of books. We've got beautiful book by Sir Andrew Sizer, Sir Tahir Mahmood, Amanda Jones, Sir Janesh Gupta. We've got beautiful book by Sir Mustafa. We've got Sir Andrew's older book, that's wonderful. Succeeding extended match questions are wonderful. We've got Respected Sarkunjai's book. That's so wonderful. People, they love it. The July batch had crammed it like anything. We do have certain mistakes in the books because they're older and the recommendations are newer. So in the open group, if you just go on the search bar and you just write the question, you will get all the corrections. Because 3 batches have done complete books and the group is full of information. You write anything on the search of my Telegram, you people would understand that everything is out there and you'll find so many references and answers because the batches had been going on with all the circulation of all these books from the first till the end, and people had been learning it perfectly. So I expect all of you to start the books with the September batch, which they are doing. You people will have the revision. So thank you very much, Iram. So that is Sarah, the open group, my dear. I think I added you yesterday, Sarah. The one with the 5,000 people. All right, no worries. Safa, please add Sarah Dharman. She joined 2 days back, actually. Yeah, she might not be in the open one. She's in the premium January 23, my dear. Thank you so much, sweetheart. All right, so what is my expectation? What do you guys think that how many times if you do the book, that will be okay for appearing in exam? Yeah, sure. We'll add it in the link again. Safa will add the link in the premium. You just click on that, okay? All right. Tabinda says 6 times, ma'am. Tabinda, multiple times. All right, Pranita. Tanuja, sure, my dear. Just give me these 1-2 hours. I'm going to put everything in the premium group, okay? No worries, Amy. You just joined today as well, Amy, my dear. I will add you, sweetheart. Don't worry, okay? Just once, she's going to put the link in the premium group. You all can join from there, all right? Okay. Yeah, thank you very much. Aisha, I've just added you, but your previous number, which was with me, the UK number, I think I've just added 30 minutes back, Aisha, I added my dear. Okay. All right. Okay. So please tell me how many times do we do the books and you think that it's fine? Right. Okay. So let me tell you guys that generally doing books is an art. Okay. And I don't want to waste your time. Meeting you today, the reason is that we should learn this art that had to be focused. We all are mummies, we all are wives, we all are working in hospitals, we all have domestic chores, we've got lots of works, and yes, we have got MRCOG as well, right? So people are not going to expect us like, okay, you leave every job and you do MRCOG. So we have to learn being smart. We have to learn being focused, okay? Now, I always tell students and guide students to do the book in a perfect manner. What is that? For example, we open up Sharlita Datta and Tahir Mahmood, that's in front of us on the screen, right? We just open it up and we start doing it. You open up paper 1, paper 2, every paper has got their 5 papers in Tahir Mahmood and there are 50 questions each. Now, if you just open up paper 1 and you start doing it, there would be a question somewhere in between that nice first line recommendation for HMB is. And I'm sure that everybody who has passed MRCOG Part 1 knows the answer. What is the first line recommendation for the NICE HMB? Yes, what is that? Yes, I'm coming to that, my dear. Thank you very much. You all know it. Now, this question you will find in each book. And this question you will find in each exam tested paper from 2015 till 2022. So that means that every student has got some basal level as well, right? It's not that you people are blank. Yes, maybe a few students are like starting from 30%, few are starting from 50%, few are starting from 10%, but specifically every single student, every individual student has some baseline information from where we are stepping forward, right? Sarah, all the books are there in the channel. All right, she's going to give you all the books are in the channel and everything is downloadable from there. Okay. All right. Now, what I mean to say is that first time, for example, Pranita has opened Tahir Mahmood. Pranita is doing the question number 1 to question number 50. She did 5 questions right. No problem. At least she did 5 questions right, right? And the 45 questions she has marked. Okay. Now, for the next time, when she will do it, second go, those 45 marked question, she would definitely do 20, 30 more right. So maybe 5 or 10 are left, which are still incorrect. So in the third go, those 5, 10 marked. So what I used to do for myself, I used to keep like different highlighters. If you just see my Tahir Mahmood, it would have a yellow highlighter, it would have a pink highlighter, it would have a green highlighter. So yellow highlighter was my first go, right? Pink highlighter was my second go. The green was the last one. And just before exam, I think 10 days before exam, I completed all the books maybe in 2 days. Why? Because I had written all the points which I used to do wrong. I used to make my one-liners and I used to correct the books. And that means that if you do in an organized manner, you basically make your books from 100 pages to very, very less. I mean, at the end, you're left with hardly maybe 20, 25 pages to revise. Do you people get my point? Yes, this is exactly you people have to focus upon. In simple words, see, IUS is for HMB. You all know this, but every time reading this question would take your precious 2 minutes. Am I right? Do you people understand, Afreen? Every time reading this question in each book would take you 2 minutes. So, all right, for first time, if you're taking 2 minutes, it's all right. But next time, the non-highlighted part, you're not going to read because they are at your spinal level. Am I able to clarify, friends? Did you people understand? Yes? Right? So what I want is that you should know the art of winning the exam. I cleared all my parts in one go. Reason for that is not that I'm superhuman being. It's all because being a smart student is requirement of MRCOG-2. It's a huge curriculum, believe me. So doing books is like you would start loving doing books if you'll come to the open group. Students are so enthusiastic. And at the end of the day, we receive so many messages and we are happy about this, that students take it as a challenge. That, okay, we are correcting it. Ma'am, Tahir Mahmood has this key. Ma'am, Kunje has that key. Ma'am, P. Sinha has this key. When they start comparing, I realize, and I tell to my team and moderators, yes, this batch is doing great. Because now I understand from the level of their questions that how they're comparing the keys and how they're comparing the buzzwords, comparing the age, comparing the gestation, comparing the symptoms. So I want you guys from the very start to rise up in your level and come to the point where exactly we are exam focused. Do you people understand? Pranita, my dear, everything would go side by side and I'll tell you how. When I'll explain to you that how the notes are being made, you people will understand. See, there are two types of learning. First is that we only read the guidelines and then we start doing the question. Second is that we start doing the guidelines side by side and parallel to it, we start doing the books cover to cover. There would be certain topics which we don't know, but we learn it from the books. No problem. It's making our basal knowledge better. Moreover, parallel doing books benefit is that we are practicing the SPAs and EMQ. It is improving our clinical acumen of choosing the answers. So Neha, we are going to do side by side parallel. It is mandatory, right? If anything is not done, for example, you have not covered any topic and it comes in the book, it's absolutely okay. You're learning from that question. When you'll come to the guideline, you would say, oh yes, I read this question when Brian McGowan was being done in the group. Do you people understand? Do you people understand? No study is wasted. It's just like things are going parallel so that you're not wasting your time. And it is actually the basal knowledge is getting better every day. Okay, so these books, as per the priority list, it has been given in your study group, right? All the books in the priority have been given. That is the sequence you're going to follow, and that sequence is sufficient, right? Retrograde from books and guidelines as well, both. Vani, I appreciate that, and I always suggest students who have less time, for example, in the last 2 months, they practice more of the books and the strategy. Nobody is going to skip strategy. That definitely is very, very important. That makes your basis quite strong. And in the end, definitely the exam tested questions, they play a role. Now, let me clarify one thing, please. Nothing in MRCOG is 100%. Like, for example, a student says that I have done each word of the guideline, and I've not left anything, ma'am. Would I pass? Another student says that, ma'am, I've not done the guidelines, but I've done each book 5 times. Would I pass? I have done only strategy, would I pass? I have done only exam tested questions, would I pass? The answer is no to each question here. Reason being that everything has its own role. You can't appear an exam if you don't have a strong baseline knowledge, not only in part 2, that's going to help you in your part 3 as well. Moreover, you can't appear an exam if you have not done the books even. Students, they realize, unfortunately, when they miss out their first exam and they do their self-analysis and they say, yes, ma'am, we just read the guidelines, we didn't do the books. We didn't practice questions. So practicing is equally important, but practicing tells you that how important it is. When I will make notes in front of you now, just in a bit, you people would realize that how my third go has improved my understanding so well, and how you're going to appear an exam with so much of confidence. When I take session, I tell students, okay, page number 25, Brian McGowan says this, page number 35, Kunje says this. Students are like, how, ma'am? I tell them, because this is how the practice is. You learn the guideline and you apply it from the book side. I tell them that strategy says this. Reason being that you understand the gist, that the memory is always better when there is a revision. And this is the way of revision actually, right? I would exactly tell you when I'll make notes that how important it is to do books, and you people will just see that in another 5 minutes, that how we have to make our memory better to give our 100% to this curriculum, right? Okay, yes, Shweta, I'm going to take all the questions, definitely, yes. All right, so I'm just giving a glimpse to all those. You all are in the study group, and Sarah and Ami, you all joined today, my dear. People who have all joined today, don't miss out, please. All the live session schedule is pinned in the Telegram, and it's also given in the announcement section. All right, okay. I will tell you, Sandha, please, my dear, every question I'm going to take one by one, all right? Ira Majid in the premium Facebook, premium Telegram, all right? January 2023, the paid group, that's all pinned there and nothing is missed out. Every single announcement is there. So all the details till the end of the course, all the schedule has been given. I've just given the starting of 16th of July, but you know that there are many pages. I didn't want to give it open. So it's all your paid schedule, which is with you guys every day, what you have to learn. According to that, you have to do your quiz. Every evening, you have to sit for the book discussion. You all know this detail and you people are well versed with this, right? Yes, okay, in the paid group, it is pinned in the Telegram. Moderators are answering there. I'm right there in the announcement section of the Facebook group. All the live session schedules and the daily reading schedule is there with all the timings of your book discussion, what book is being done, with all the other groups which you need to join. Everything is out there. If anybody has not received or if anybody has not checked, please drop in a message in your paid Telegram or write in the Facebook group. The moderators and the coordinators would be there to settle the query. And definitely after the session, I would be there back as well. Okay, right? All right. So please don't miss out because today you had your first guideline. Yesterday you did it and today also. So your guidelines have started. Anyone who is messaging me that, ma'am, I've got some commitment for 10 days, for 15 days, I definitely respect that. But the problem is that when you have a backlog, for example, one guideline a day is not a problem, but definitely 10, 15 guidelines, when they just like pile up, then it gives you stress and the chances of like picking it up and doing it becomes a problem, right? So try to cover it up with the daily schedule. But if there would be, Amy, my dear, it's already there. I'll tag you there, okay? No worries at all. Schedule is already there, but you just need a tag of your name. That would be done, okay? Just give me a few minutes. I'll just complete the session. I'll get back to it, all right? Yes, Mariam, the books are being discussed daily. Good to see you, Mariam, here. Thank you so much. All right. Yeah, sure, Aisha, I will do that, my dear. Okay, Sapna, that's going to be discussed in the paid group. All right, Sapna, you will discuss that in the paid group. I'll send a voice note on that. Safa will discuss about all the details there. All right, very welcome, Aisha. All right, so far, am I clear about the exam pattern? Harshita, all right. Am I clear about the exam pattern? Please tell me, give me a thumbs up if I'm clear about the exam pattern. Am I clear about what curriculum contains? Yes. Am I clear about the practice books? Am I clear about the guidelines which we have to cover? Yes. All right. This is the outline of MRCOG Part 2. Now, the basic problem which you people were facing was how to make notes. I got a message that, ma'am, I'm making notes, and at the end of the day, I'm copying the entire guideline, and my notebook is a replica of the Green Top guideline. Who was that girl? Who messaged me this? Right, I loved it because she's not the only one who messaged me this. Every student is messaging the same, right? Every student is messaging the same, that, ma'am, I don't understand that what to actually write and what to skip in that actually. So you people are absolutely right in having this difficulty, because when we are starting, we are not understanding anything as well. That's absolutely right. How you understand when you go to the books, you see, okay, this question has been asked. So I don't understand. So if I'm writing everything from the guideline, isn't it better that I take a printout of the guideline and I start reading that? I mean, why am I writing with my own hands if I'm writing the complete guideline in my notebook, right? And this feeling is like so natural and so understandable. All right. Now, what you have to do is that, see, making notes would not be a one-day task. It would take 2 to 3 months to get completed. Now, you people would be astonished that, what is ma'am saying? I mean, one guideline, 3 months? The answer is yes, Noor. The answer is yes. How would it happen? Now, I'm not your mentor. Now, for the time being, I'm a student, right? And I am reading the guideline for today. And that guideline is Management of Ovarian Hyperstimulation Syndrome, right? It's Green Top Guideline number 5. Published in February 2016, and I am making my notes from the management of OHSS. I don't know anything. Thank you very much, Irib. I don't know anything, right? I'm just reading it for the first time, right? And I would just pick up the basic points, how we are going to do that. Now, when you pick up a guideline, you always have to remember, as I told you earlier, the priority is always to the recommendations. Here comes your first question. Students, they say that, ma'am, I've got less time. So is it okay that we only do the summary, or we have to go to the complete guideline? My answer is always that first go of complete guideline gives you some sort of an internal confidence. All right, I've gone through the guideline, nothing is missing. And if you only see, or if you only read the summary by someone else, or for that matter, even on my own website, if you just go to the summary, it would have some feeling that you're missing out something, right? I can understand that few guidelines are bigger and few guidelines are smaller. So the bigger guidelines before starting makes you have tachycardia and palpitation. Oh my God, before starting, you are tired. That on the first page, you feel, oh my God, 100 pages. So you stay on the first page forever. I can totally understand this feeling. So what do we have to do? We have to tell ourselves, and we have to settle ourselves, that recommendations are very, very important, right? Now, for the newcomers, I would like to tell you that what recommendations are. The step number 1 in making the notes is that you have to put all the recommendations separate. Let's read the recommendations which are most important. Prachi, I totally understand. I'm your type as well. Yes, Prachi is my friend. So let's make Prachi's notes. Okay, friends? Prachi is making these notes. We read the recommendations, and that's very important that I told you from the beginning that none of the point from the recommendation should be missing, right? So on the left-hand side, we have got the Management of Ovarian Hyperstimulation Syndrome, and these are Prachi's notes. What you have to do in the first go is that there are 2 ways. If you people are good in writing, for example, if you talk about myself, there are 2 different types of students, right? If you talk about myself, I had a good memory with my handwriting. So if you take out time for guideline in the beginning, that would save you forever, not only in MRCOG Part 2, even in your MRCOG Part 3. Now, everyone has to understand, please, the recommendations are which points? The recommendations are these bold points. These are the recommendations, right? These bold points are the recommendations. In few guidelines, they are within the guideline, and in few guidelines which were published later, they're from the very start. All the bold points and the recommendations are together. So the first goal of the guideline is that you put all the executive summary of recommendations on your notes. If you have time, please write it down. If you have got a busy schedule that day, please don't leave it. Add, copy, paste, add all the recommendations on one page, and please take a printout. I would prefer that MRCOG Part 2 students, they do have a printer at home, because many times you have to take printouts of tables and you have to, paste it on your notebooks, tables, algorithms. So it would be good if you have it. If you don't have it, it's all right. You can make a folder and you can send someone for the printout, but do take a printout and do all the recommendations separately. The recommendations would keep on going till 2, 3, 4 pages until and unless they end up before purpose and scope. So basically, till here is going to be your recommendation, right? Shweta, I can understand, right? So definitely, yes, for my MRCPA, for my MRCOG, every time, because I'm the type, so I used to take so many printouts. So, your own printer definitely helps. But if it's not possible, everybody has got, his or her own circumstances, you can send for the printout. But for the tables, algorithm writing down takes lots of time. So you can simply take a printout of the table and you can just paste it on the notebook, all right? Okay. Now, till purpose and scope, basically you have done with your recommendations. Now, how would your notes look like? Now, this is Prachi's notes when I've covered up all the recommendations, and I should have a grip over the recommendations. So the clinicians must remain alert to the possible signs and symptoms, the possibility of OHSS. The symptoms and signs should be clear on the clinical criteria. They should be knowing about the severity of OHSS and their grading. And there are certain licensed centers, they should comply with the Human Fertilization and Embryology Authority regulations. And the units that treat the women with OHSS should inform the licensed center. Now I'm a student, right? I don't know anything in terms of the importance of these, but I'm learning these recommendations because I'm starting the guideline. In the second and the third go, you people would see that how I become a good student, a learned student, okay? The fertility clinics should provide the verbal and the written information, and they should also have a 24-hour contact telephone number. All acute units where women with suspected OHSS are likely to present should establish the agreed local protocols for the assessment and management of these women. And licensed centers should have a close liaison and coordination with acute units where their patients may present. The women presenting with symptoms suggestive of OHSS should be assessed face-to-face by a clinician. And if there is any doubt about the diagnosis or if the severity is likely to be greater than mild. Harshita, iPad, I always make through good notes. And that's a very good thing. I always make through good notes. And that's something like I'll tell you in the end. Harshita, save this question. Don't forget it. Just after completing this, I'm going to tell you about that. Okay. Don't forget that because I've got very good tips for that. All my folders are saved in my iPad. Okay. All right. Then outpatient management recommendation regarding the fluid intake and output management, the non-steroidal anti-inflammatory agents should be avoided. So I'll put a cross in my notes that it should not be given right now because it's my first go. I don't know importance of all this, but I find while reading this, okay, NSAIDs should not be given. Yeah, this is an important point, right? Women with severe OHSS being managed on an outpatient basis should receive thromboprophylaxis with low molecular weight heparin. So this also seems important to me. Okay, LMWH needs to be given. Paracentesis of ascitic fluid may be carried out on outpatient basis by the abdominal and transvaginal route under ultrasound guidance. Okay, this is a recommendation. And women with OHSS being managed on an outpatient basis should be reviewed urgently if they develop symptoms or signs of worsening OHSS in every 2 to 3 days. All right, so they should come every 2 to 3 days. And hematocrit is a useful guide to the degree of intravascular volume depletion. Now, I am writing all this. Okay, they tell me in the recommendations that hospital admission should be considered for women who are unable to achieve the satisfactory pain control, are unable to maintain the adequate fluid intake due to nausea, shows signs of worsening of OHSS, or have the critical OHSS, or cannot come for the regular follow-up. Now, Satri Pranita, because today I'm not teaching you OHSS. Had it been a teaching, I would have told you the meaning or the recommendation or the interpretation for MRCOG Part 2 for each guideline. I'm a student at the moment, and I have given the first go to this guideline, right? So these are my pages for the recommendation, which I have copied for myself. And this is my first step of reading a guideline. At least I know that this guideline says what we need for the multidisciplinary assistance. The features of the critical OHSS should be in the intensive care. Okay, I understand that. If a patient is admitted with OHSS, has to be seen at least daily. Analgesia and antiemetics should be given for the symptoms, but avoiding the NSAIDs. So no NSAIDs here. I've read it from the recommendations and I've learned it. Fluid replacement by the oral route guided by thirst. Okay, I've learned it. And if at all the patient has got persistent hemoconcentration, we need to have anesthesia input in that situation. Diuretics should be avoided because they further deplete the intravascular volume. And if at all the paracentesis is required, if she has severe abdominal distension, shortness of breath, respiratory compromise, secondary to the ascites, and increased intra-abdominal pressure, or if it's an oliguria, despite adequate volume replacement, we need to take a decision of paracentesis. Now, the recommendations have ended to the point that paracentesis should be ultrasound guided. And if it's more fluid removed, intravenous colloid therapy should be done. Women with severe and critical OHSS should be given low molecular weight heparin. I find it an important point as a student while reading, so I've highlighted it for myself. Women with moderate OHSS should be evaluated for some additional risk factors for thrombosis, and they should be given anti-embolic strokings and low molecular weight if indicated, because in the upper recommendation, they're saying severe or critical OHSS should receive low molecular weight heparin. That means moderate, we have to analyze as per additional risk factors, right? And then they say that if the patient has got some additional problem in terms of coincidental torsion, surgery would be required. They say that in the recommendations that the pregnancy is complicated by OHSS may be at increased risk of preeclampsia and preterm delivery. All right. Yes, definitely. Yes, Adam, it's being on record. So definitely you'll get that. Okay. Now what we have done is we have done the first read. Okay. Now, just for my own assessment, I have taken 2 hours for this. Do you guys think, I'm not saying that kids around, television around, or in the kitchen. If you separately give time for the first read, please, and making this separately in just one sheet, only the recommendation. Am I right in saying that 2 hours are fine? Yeah, but I understand that at times it happens that, we read 2-3 lines and then we just get some tasks to be done for some children, and then we come back and then we cut a fruit and we come back. Not like that, please. If separately you are doing this without any interruption, 2 hours would be fine, right? I want to tell you guys that it's doable. It's not something, it's just the step number 1, right? I expect you guys that please, when you're reading, put everything aside. I mean, your task for the kitchen, your task for your kids' responsibility, everything, please settle that and then sit for 2 hours and do the recommendations. That would definitely be. Noor, if you have your hospital and you have to do this guideline, the previous day you will gather up the recommendations and then you'll read on duty. But the recommendations you'll gather up previous day because next day is your duty. So we have to work on the duty days like this. Got it, Noor? Okay, what is step number 2? Step number 1 is for those who actually don't have time and they only have 2 hours. At least recommendation is my minimum requirement. That is my minimum requirement which you have done. If you can give additional 1 hour, then you will start from purpose and scope and you will read the details. Now, in reading the details, there's a way of reading the details. The reading details, it starts from this purpose and scope, right? Before that were recommendations. So whatever you understand that this point is not in the recommendation, I find it's important. Afreen, where are you, my dear? Noor, Prachi, everybody please. In the guideline, you people would see that there are certain Cochrane data, there are certain researches, there's certain abbreviations in terms of the hospital workups have been given. Please ignore. If one or two odd one out questions would come from there, we'll do it from the strategy, we'll do it from the exam tested question. Do not pay extra attention because you can't memorize those researches. They are just to reach to the recommendation. For example, Prachi, if they are giving you some sort of a complete detail that, you know, these much patients we took and this was the outcome, they are giving you the background of what was the reason that we found that recommendation. Do people understand? Now, when I will do the guideline, for example, I read the introduction and I saw from this point, please, everybody, please pay attention here. Exposure of the hyperstimulated ovaries to HCG leads to the production and pro-inflammatory mediators. Chief among these is vascular endothelial growth factor. All right, so now I see it's not in the recommendation. So what I'll do is that I'll take a different pen, or for that matter, if you're doing copy paste and you're doing that on your laptop, you'll change the ink color and you'll do it in the different. So you know that what are the recommendations color and what is the detail color. So now is the detailed reading part. So whatever you read in between, you take those points only. And if somebody is doing the good notes, that's beautiful application. All my OSCE notes, all my students' notes, whatever I have to work, I always work on the good notes. Now, it's not their promotion, actually. It's very users friendly. You keep on highlighting, you keep on, you know, scribble out there. It's very users friendly. On the iPad, it's available. And I think in the Android, it's available as well. That gives your saving documents very easily, you know, it's done. Because one of the difficulties is when you have to travel, you can't carry up lots of books. I mean, I remember that students, they tell that, ma'am, complete one bag is only my books. So if you're doing and saving the things online, that gives you a benefit that, okay, your folders are saved and it's like easy nowadays when you have to, you know, study as well, when you have to travel as well. Okay. So in the second go, you will highlight from the details and you will put these points. Now I'm taking all these points. For example, it's written somewhere here in the diagnosis that early OHSS usually presents within 7 days. Now I don't know that it's important or not, but I find out that, okay, I should be knowing about this, that early OHSS is usually presenting within 7 days of HCG injection, and late OHSS presents like 10 days or more after the HCG injection. Okay, so 7 days and 10 days seems to be important, right? That this criteria I should be knowing about. Then when I go to the detail of the guideline, I see, okay, table 1 and table 2 regarding the history and examination is given. So I'll print out that table and I'll put it in my notes, right? So Sapna, I'll tell you, my dear, I'll send the picture in the study group, okay? So yeah, thank you very much, Noor. That's really helpful, the good notes application. Onset, trigger, number of follicles, number of eggs. So the relevant history I'll paste. Now coming to the other table, which I get like examination, I'll paste that examination and investigation there as well, right? That would help me that now, okay, tables and algorithm. Generally, let me tell you guys now, coming back to the mentor side, that tables, algorithms are super important when it comes to the Green Top guideline. Every time the questions are formulated, even from the NICE and the TOGs as well. Whenever there's some table, that should not be missed, right? And then I see the RCOG classification. I found it in the recommendations that it is important. In the details, I found it, the mild, the moderate, the severe, and the critical OHSS, right? Now I'm pasting all this in my notes. And what does my notes contain now? Now, if it's all the tables have been done, you have done the detail of your guideline, it would take another 1 hour because the recommendations you have already done. Okay, so you've highlighted the points in between. Whatever points you think are added, you're going to change the ink and you're going to put in the notes again to make it the step number 2 detail. That would include everything which is inside, which was not in the recommendation, which you feel is important, that might not be important for exam point of view, but while reading, you think that, okay, I should be knowing about this. Right? That is about the hospital admission requirements. That is about the worsening of the OHSs and the tables, which were not in the recommendation. So now in the end, how does the notes appear? Now, once you have gathered up everything, for example, I'll give you one example. They were writing in the recommendation that NSATs should not be given. This was the recommendation. When I came to the guideline in between, can you see, all of you, can you see here? This purple highlighted part, the recommendation was that analgesia and antiemetics may be used in women with OHSS, avoiding NSAIDs and medicines contraindicated in pregnancy. Everybody, are you with me? This was the recommendation, right? Recommendation. The second thing which I have to tell you is that after recommendation, when you reach up to this point, you read in the paragraph that NSAIDs should be avoided as they may compromise the renal function, right? And they give you that paracetamol and opiates can be used, right? Paracetamol and opiates can be used. So this point was not in the recommendation, but you should write in front of that. So that means that there are certain points you will find from the details which are important to see. But hardly on one page you can see, hardly you will see 2-3 lines. You don't have to go. Can you see here? You don't have to go into these all Cochrane's and the research that has been given. The odds ratio, the confidence interval. This is just to tell you that how the recommendation was made. For once, if you go through that big paragraph, that's absolutely okay. But you don't have to basically copy that paragraph because that is not required. You need not read it again. So on each page, you might get like 2 or 3 points. That's it. So what are we going to do now? Now we have completed our second go. How do my notes look like now? Now, the same notes which we made, we have added the red color. That was the detail which we had put, for example, the vascular endothelial growth factor, right? And then it is going to be early and late OHSs. We have put wherever we got this information, we have put in the notes at that very point. We have put the tables in our notes. And in the end, when NSAIDs, see, when the NSAIDs point has come, I've written in front the paracetamol and the opiates can be chosen. And where there was a point of clinicians being vigilant for signs of severity of OHSS, we have put those severity signs. That means what? That means that now our second go, this guideline is complete. We don't have to go. We don't have to go back to the guideline again till the exam. Our notes are absolutely sufficient. And at the end of the notes, we will make percentages page or a small sheet, a small stick-on of that GTG. That is the way to remember. So when your notes are ending up, the percentages of OHSS GTG you're going to put together. All right, so women with severe OHSS demonstrate hypovolemia with a typical loss of 20% of their calculated blood volume in the acute phase. So the combined incidence of moderate to severe is like 3.1 to 8%. And the incidence of thrombosis being estimated to lie between 0.7 to 10% of cases of OHSS, right? So what I mean to say is that in the end, make one page of that percentages. Even if you don't understand, in the third go, your percentages would fill up. Do people understand till point 2? The step number 1 of the GTG read and step number 2 of the GTG read is clear. If these 2 reads are clear to you guys, your job for now is done till my session. You will open it up during my session and you will highlight the points which I'm telling to you guys and you will mark it there, right? Let's come to the step number 3, which you people are doing in my open Telegram. What is that? Now you people will understand Noor. Shall we? Aisha, now you people would understand that we made our notes, right? Now we are doing cover to cover books. Okay. So while reading the practice books, now I would understand. I was Prachi while making notes, right? Yeah. So while making the notes, when I was doing these notes, I didn't know the importance. When I come to this, I realized, oh yes. So there is an Andrew Sizer single best answer, which tells us about the features of the severity of OHSS. It tells us there's this Andrew Sizer single best answer that where we have to report the Human Fertilization and Embryology Authority. There's a question in Andrew Sizer which says that which type of OHSS you have to report to HFEA. The answer is severe or critical. So now on my notes, I'll mark it, right? Brian McGowan has a single best answer. What is the pathology behind this OHSS? The answer is the vascular endothelial growth factor. Now I understand, oh wow, how important this was. Now I'm going to add these points. Kunja has got a single best answer. Which criteria would tell you that it is an early ovarian hyperstimulation syndrome? And there is a point that 7 days of HCG injection, from 7 days within the HCG injection, 7 days of pregnancy, 10 days from HCG injection, 10 days from the pregnancy. There's so many 7 days option. And I realized, oh my God, what was that? Was it 7 days of HCG injection or was it 7 days after she gets pregnant? I open up my notes and I see, oh yes, it's 7 days of HCG injection. Do you people think, would I ever forget this now? Would I ever forget this now that I've read it on my notes? I've correlated it with Pooja's single best answer and I've marked it here. I will have such a wonderful memory of this that I would never in my life forget. Yes, I know that in my notes, I've read it in the recommendation. Now I've seen the Kunja single best answer and now I know it. There's a single best answer in Sir Kunja's book which says that which patient would have reduced risk of ovarian hyperstimulation syndrome. And when I read that, I said, reduced risk? Oh my God, I've read the complete guideline. I'm Prachi, right? I was making notes, yeah? Prachi thinks that I read the whole guideline. I don't know, from where did I miss it out? I go back to the guideline, I think, oh, I have written that increased risk is with previous history of OHSS, polycystic ovarian syndrome, and increased AFC. So Kunja's answer is with decreased AMH levels are decreased risk of OHSS. Do you people understand? That now I would never forget, okay, increased risks are given here of OHSS and Kunja question is asking about the decreased risk of OHSS. So I would never forget it. You will find all the single best answers regarding categorization in all the books. I am doing a question in mastering and the question says that most common electrolyte imbalance in OHSS. And I go back to my notes that I didn't understand this. But then the guideline says that hyponatremia is most common. I missed that in making my notes because I didn't find it, Yusra. I found it like a very common thing. I didn't pick it up that it's important, right? When I saw the question, I said, oh my God, how did I miss it? So now I won't forget that hyponatremia, it's given in mastering. So there's another single best answer in Sir Kunja's book, which says that most common cause of death in OHSS. So I was like, I didn't read it in the book. And this question is not from the Green Top guideline. This question is from the talk article. But from the book, I remembered it and I have put it here on the table that most common cause of death in OHSS is thromboembolism. Vinutha, do you people get me? Yes? Brian McGowan has a question of moderate OHSS giving the symptoms. Andrew Sizer has got a question of mild OHSS. Tahir Mahmood has got a question of severe OHSS, right? Andrew Sizer has a question with ovarian size of 9 centimeters. So that means that there's a moderate OHSS given there. Do you people now understand that when we come to step number 3, we are doing books not for this reason that, we are doing it for the sake of doing. No, we have to make a memory. We have to be better. And if reaching at this third step, while doing each book, for example, you do 50 questions in the Telegram that day. Out of those 50 questions, you have to reach out to your notes. Every time you have to reach out to your notes, the ones which you've done, okay, these questions, you just mark on your notes only. And your notes would be a perfect example of learning and memorizing. Tahir Mahmood has a question that what medication we can give for analgesia in OHSS. Now, what I remember from my notes is NSAIDs should not be given. NSAIDs should not be given. But then I remember, no, paracetamol can be given. So paracetamol and codeine is the answer. Now I would not forget this recommendation, right? And there is a question in Sir Kunja's book, which should not be given. Brufen is the answer there, right? Do people get that? So this is very important. And then strategy has a question regarding that what investigation is useful to guide for the degree of intravascular volume depletion. And I'm very happy because I've read this question. I would immediately say, yes, hematocrit. I remember from the recommendation, but I put it on my notes, right? So Kunje has a question that which medication or which type of the IVF treatment should be avoided to avoid the OHSS. So the gonadotrophin agonist is given there, which is again from the recommendation. Do you people understand? Now, do you people understand that how the notes are perfect, how it's easy? I'll give you one shortcut of this as well. That's not a problem. Strategy has one question that if a patient gets pregnant with OHSS, what can be the complication? Now, if you remember it, that's perfect. If you don't remember it, go back to your notes and see, all right, so preeclampsia is one of the complications which can happen. All right. Okay. Got it, please? Thank you very much. So in this situation, this is taking time looking at you, my dear. You're doing all this side by side. All this you're doing side by side. Everything is going to be there, Neha, my dear. Don't worry. In the study group, it's there. When I come to my percentages part, the single best answer of Kunje is about the mild OHSS, and they have not got 33%. 1:3 they have given. That is basically the question which is given. Now, the step number 4 is that you are doing around October, you will be starting, or August, September, and you are going to start your exam tested question. So it won't be anything haphazard. You're taking one guideline that time, right? So whenever you see any question which is exam tested, you can make any mark for that. You know, you can put any star or you can make any highlighter so that you know from that guideline what's coming. Like severity of OHSS and reporting to HFEA is an exam question. So I'll put on my notes the star, right? Now, this fourth go is not, fifth go is not now. Only step number 1 and step number 2 is now. Step number 3 goes side by side, and step number 4 goes like till the end, till the exam, right? So notes are not final. Notes you keep on adding points, you keep on marking the questions on the notes. Simply write Q. That adds on to your memory. That's a way that you're going to just add on to your memory, right? So whenever I'll do the exam tested questions, the symptoms extended match question comes in each exam. I see that, okay, 2016, 17, 18, all have the OHSS symptoms and it's an extended match question. I'll put a star on that. So I'll put a star on the paracentesis. Paracentesis is a question which is an exam, and the worsening of hematocrit is an exam. I'll just put a star on that. Okay, this is my exam tested question. About the category RCOT classification, it always comes, the severe is an exam, the mild OHSS is one of the exam question. So I'll put a star on that. That would really help. So in this way, low molecular weight prophylaxis is overlapping with Green Top Guideline 37A. And again, I'll put a star here. That would help that this guideline has this question that we have to give for the severe and the critical low molecular weight heparin. That is your exam question. So again, I'll open the notes and I'll highlight, okay, these are the exam tested question. The moderate to severe OHSS 3.1 to 8% has been coming in 2020, 21. Even in the recent exam, they asked this percentage. So I'll put a star on this. So when you'll be doing your revision, you will be knowing all the books recommendations, the exam questions, you would be knowing everything. So that would all be important. And what would your final notes look like? Let's do a quick recap. Step number 1, now read recommendation for today's guideline. Step number 2, just add the required details. Step number 3, later, whenever you're doing book, any 50 questions a day, from which guideline it is, just mark them later. So not a difficulty situation. You'll do questions so many times. You will have the, intensive discussion with Safa, intensive discussion with moderators. You will do the questions so many times. You will have an opportunity to open up your notes and mark on that. Step number 4, you mark the exam tested questions, and definitely the point is not that people, they don't read for MRCOG-2. The point is that they can't retain what they're reading. So what I'm telling you is the best way to retain, and it definitely is not a problem. So this is the final notes, how they look like. With all the marking of the exam questions, with all the marking of your recommendation, with all the marking of your exam tested and the books question, and this is how you're going to have a better memory. And it's just a matter of 6 pages as compared to 25 pages of the guideline. Do you people understand? This is the final look of your notes, which I tried because, of course, it's a PowerPoint. It can't be that, closer to the reality, but I tried to give you the concept that how you can make, because from the last 1 week, I was getting so many messages, right? Recap taking us. Yeah, this Noor, you're going to get all the recording, my dear. All the records are going to be with. Yeah, please. This is a recap. All right. Okay, that's like my girl, Sarah. Thank you very much. Yes, Afrin, am I clear now? Right? Okay, so now I can understand that every student is different. Few of you are at home, few of you are at breaks, few of you are with very busy hospitals and busy routines. Few of you don't have the support in terms of like household you people have to take care of. I totally respect and understand. According to that, we can just, mold ourselves. Now, according to that, we can simply, adjust. Okay, I'm getting private messages. Please, I'm going to respond to all of you out there. At the moment, I can't simply see the WhatsApp. I hope you guys understand. The ones who are from the paid group, they all have already joined. But the ones who have already joined to the regular group, they should be knowing about being in the premium January Telegram and the premium Facebook. Please don't miss it out because all the announcements are there only, okay? And the ones who want to join, definitely, yes, you people can join. And students have been requesting me again and again, ma'am, we need Eid off. We need Eid off. And Safa messaged me, and the website support also messaged me for this. And Gia, the coordinator, was also messaging me. I said that, ma'am, messages from students that please give us Eid off. I said, Eid is going to be next year now. It can't be an Eid off. So the ones who just want to avail that, I'm extremely, extremely grateful for the lovely response. Already your strength has reached so high before starting the course. I know it's 569, but all those who just want to join in next 24 hours, that's just because of the moderators and the coordinators' sake, because they're receiving lots of messages. FIFTY RFA, that's going to be the coupon. You people can do that in 50% off, but please only for 24 hours because it's difficult to keep the coupon a little longer. And the credit goes to the backend team and to the coordinators who have made this for you guys, because I think 15, 20 friends, they had been coming up like as groups and all, they had been messaging them. So I can totally understand that definitely when you're coming as groups, you people want the finances to be easy as well, right? Okay, so all the recordings are going to be with you guys. That's not a problem. On your portal, that would be uploaded, please. Okay, that's not a problem. All right, so now tell me one by one all the questions. We are going to take the things which you people are not clear about and about the good notes as well, Harshita, right? Yusra has a question. All right, Yusra. So let me ask you guys to unmute yourself. All right. Yes, my dear. Thank you so much, Sati. So happy to see you.
Hello, Miss.
Hi.
Hello, Dr. Sidra.
How are you, sweetheart? How are you?
Alhamdulillah, fine. Alhamdulillah. I'm so happy to join your course.
So grateful, my dear. My pleasure. Sarah, we are going to do only single best answers and extended question from strategy, okay? Yes, only single best answers. Yes, my dear Yusra, please.
Okay, I have many questions. First, what about strat of OG? Is it fixed questions each time, or they are changing?
Yusra, after each session, I'm going to give a homework, and module-wise, we are going to do. They would not be changing. They would be the same, and only single best answers and extended match questions needs to be done. Okay. All right.
Okay, and shall I subscribe buy the course? Is it better to buy it?
No, it's okay, my dear. I'm going to guide you. I'll send you the link for the details. Okay, I'll guide you. Just drop in a message on WhatsApp.
Okay. Second question. I have a second question.
Oh, please. Sure.
While reading NICE guideline, they said, for example, they said, for example, refer to this guideline for more details. Shall I go to that guideline? It is a very huge guideline, or just
it's okay. Skip it at that time. Skip it at that time. And when you read that guideline, when all the guidelines would be over, you'll understand that point. Or you can put in the study group that, ma'am, can you explain it for me for now? I'll read that guideline when its module would approach. Okay. So we'll do. All right.
Okay. There is a third question. Yeah. What about solving the question on the books while we're not reading? You know, we haven't read the guideline.
Absolutely okay, Yusra. That gives you very good information. No, that actually adds to your information. If you don't know anything and if you're reading it, that means that it's adding on to the points. All right. Okay, this is how the question comes. So I'm telling you that we'll go parallel. Because if you're reading a guideline and if you're not doing a books, or if you're doing the books, it gives you an idea. Okay, this is how from this guideline the question is formulated. This adds on to your memory. You never forget this.
Okay. Thank you so much. Thank you so much,
Yusra. My pleasure, my dear. Be active in the study group. Thank you so much. Thank you. All right, we have got hand raising from Sadia. Hi, Sadia.
Hi. Hello. How are you, ma'am?
How are you doing? I'm fine, Sadia. How are you?
I'm also fine. I just want to know that how to do the books. I did not get that at the time, that how to filter these SBN books.
All right. So we've got 2 p.m. GMT. Dr. Ala, moderator of RFA Tutors, she is going to start. And she definitely seeks permission, and then she starts. She gives me a message, then she starts it, then she gives the references for the questions out there. So it's going to be there like that in that time period. So fixed number of questions as per schedule. Sadia, have you got the schedule of the book practiced?
Yes, I have got that, but it's very difficult to follow them.
It's absolutely okay. I'll tell you, Sadia, if you're not available at that time, right? What I expect is, for example, if there are 50 questions, before sleeping, do those 50 questions. I mean, scan the question and the answer, question and answer. And if you've got any query, just tag there.
Okay.
I mean, live, it's difficult at times, you know, at times the guests are there, at times some commitment is there. It's all right. Before sleeping, just scan. Make your routine that before sleeping, you have to do those 50 questions. And out of that, Sadia, make a notebook. If you don't know out of those 50 questions, if you don't know any questions, make a notebook of revision questions. Start writing one-liners from today. You will see that your vocabulary in terms of MRCOG Part 2 would get so much improved in another 1.5 months.
Okay, and as you say that there are a lot of books like Tahir Mahmood and Andrew Sizes. I want to know that how to filter that books and how to.
You don't have to filter. You just have to. You don't have to filter. You just have to take the printouts. If you're happy to do that by taking in your hands, if you're happy on the screen, you can simply do that on the screen. Do it as per priority as we have made the list. That's it.
Okay. Thank you.
Thank you very much. Thank you. Take very good care, Sadia.
Thank you.
All right. Yes. Aparna, how are you doing?
Yeah, hi, good evening, ma'am.
Good evening. Busy Aparna in hospital, right? Yes. Sorry, Aparna. Aparna, if you're busy, I can take your question later. Hello. Follow me.
Yes, ma'am. Good evening, ma'am.
Good evening, sweetheart. You're busy out there. Yes, my dear.
Yeah, I wanted to ask, you told about the how to make summaries of the recommendations in GTGs.
Yes, my dear.
But what about the talks, ma'am? For the talks, also we need to make the summaries, or
talks are very small. The generally the website summaries are absolutely sufficient. Add points on that. What students
Okay.
they generally do is that, yeah, they just do the summaries of the website. And then after that, they do add the points. For example, if in the exam, the electrocautery, this stable question is come, they'll just put in there. Adenosine question is there in exam, they'll just put the Q over there. So, so add points over the talk. But the summaries are sufficient as like a baseline.
Ma'am,
Okay.
one more thing, when I logged into the website, there were
Yes, ma'am.
summaries or index of the summaries, but most of them were the GT. The talks are also in that only, or
Yes,
there
my
is a
dear. The
separate
talks are
folder
not
for
in the GP. Follow me. Go to the website tour and see that. Okay. There, the
Okay.
PTG is a separate folder. NICE is a separate folder, my dear. The TOG is a separate folder year-wise. Okay. Till 2022 April, everything is updated. Okay.
Okay. Thank
All
you.
right. Thank you very much. Thank you. Yes. Any other question, please?
Ma'am,
Okay. We have got
good
hand
evening, ma'am.
raising. Hello. Yes, Priyanka. How are you doing?
Ma'am, yes, ma'am, I'm good, ma'am. How are you, ma'am?
I'm very well, sweetheart. Yes, my dear.
Ma'am, I have only one question, ma'am.
Sure.
We have a live session on Sunday, no, ma'am. Is it that Monday to Saturday your topics are covered in that live session, ma'am? That is a revision of that Monday to Saturday
The
topics,
daily, exactly, yes. The daily schedule which has been given to you, for example, it's gynecology. You will complete the gynecology topics. You will meet me in Gyne 1. That topics you have read earlier. Then I'll meet you in live session. Okay. Then
Okay,
you start
okay.
the Gyne 2. So the daily discussion and the live sessions, they go side by side, my dear.
Okay, thank you, ma'am.
They'll be coordinated, Priyanka. Okay. So Priyanka, you know, what do I expect? That while reading those topics, when you have question, you write down in your notebook so that in the session, I can take those questions and clarify. That's the benefit.
Thank
Got
you.
it? Okay, thank you very much. All right, Pulami, my dear, you need to say something?
No, ma'am. I'm
Okay,
done.
thank you so much.
Ma'am, I have a question, ma'am.
Yes,
One
how are
question.
you doing, Kamrun?
Yeah, ma'am, I'm fine.
That's
Ma'am, I have a
good.
question that
Yes.
every day after the discussion, you share some questions. What are the sources of that questions in Telegram group? Is
Where
that
do I
from
share the
previous?
question? Quiz.
Ma'am, just what we are practicing after each discussion in our premium group. What are the sources of that question? That poll
Okay,
type
that's
question.
from all
Yeah.
the books the folders had been made. From everywhere regarding that topic, we pick it up. It includes
Okay,
everything, every possible thing. Okay.
Okay. Ma'am, you have shared some pictures in this intro section, some book picture.
Yes.
Should you revise all the books or?
Kamrun, for one go, yes, it's fine, but we'll prioritize like which are must. So 10 books are must, and that sequence has been given in the book discussion. We are doing priority wise, like importance wise, because certain books are recent, my dear Kamrun, certain books are a little older. Quality of the questions are good in everything, but see, the keys are a little trouble because they're older ones.
Yeah, ma'am. Okay. Thank you, ma'am. Thank you very much.
Thank you, Kamran. Take very good care of yourself. Happy to listen to your voice. I love the voice from Bangladesh, right? Thank you so much. Okay, Sadia, you're done. Your hand is still raised. Tanuja, how are you doing? Hi, this is Shivani.
Yes. Hello, ma'am.
Hi, Shivani. How are you doing? I'm fine. How are you doing?
Fine. How are you? I'm good.
Thank
good,
you
ma'am.
so much. Yes,
Basically, I just wanted to ask that all the questions will be on the Telegram only because I'm not using Facebook much, and so
Shivani,
since my schedule is like
I know students, they are at times they are not very well versed with Telegram. Few of the students are not very well versed with Facebook. The benefit of the Facebook is that we make wonderful threads out there of the confusion, questions, and all. So if you're not using that like for the social purpose, you can simply use it for the study purpose. Please make one account for me and just get added.
Okay, ma'am. I'll make an account and I'll
definitely just send me the request. Yeah, you send me the request with the email. I will add you.
Link and you just add me on that.
I will definitely add you. The benefit of that is that there are certain things which we can't do in the Telegram. We have to do on the Facebook. So it's always better to have both of them. And those threads, you will love it with students they make, right? Okay. Thank you.
Hello, ma'am.
Yes, my dear. Make hello, Pranita.
One more thing I just wanted to ask.
Hello, ma'am.
Yes, Pranita, your voice is not clear. Please come again, sweetheart.
Yeah, I am just confused about the book discussion. So what I wanted is just like in the mornings, I have understood two things. We have strategy to solve and we have book discussion at 2 PMT.
Yeah.
And evening we discuss the daily topics. That's what I have understood till now. But still I feel I'm missing on something. So
No,
if
Pranita,
you can make a daily activity.
No, you'll not miss out the daily activity. This is how the things are going to be. The timings are so far this. And Safa, do me a favor, please write one message with all the timings again. And let's make it an announcement section again. I've put it in the announcement section, but Pranita, I will ask her to tag you again so that you don't miss it out, right? Thank you. Very welcome, sweetheart. Thank you so much.
Hello, ma'am.
All right. So, hi.
Hello, ma'am. Ma'am, I would request you to enlist the books as well as from where we can download the download links.
Tanuja, message on my WhatsApp or message or you've seen the link in the premium?
Ma'am, I'm in that group. I'm not knowing, is it the paid group or
the open
other group?
Yeah. Tanuja, okay. The premium is the paid group where you are, right?
Okay, ma'am.
The 5,000 people, the 5,000 people. Yeah, okay. Tanuja, you just write there. After the session, I'll take all the questions. Just write in the premium group, ma'am, I need the books links. Okay, just put it there.
Okay.
Thank you, thank you very much.
Ma'am, hello.
Yes, follow me.
Ma'am, the summaries which you are posting daily at around 11 o'clock in the morning. So those summaries and the ones which are given in the website, are they same? Or like
no, they're not same. But summary is a summary. So there would not be any much change. Yeah.
Okay.
Right?
Yeah.
Okay.
Hello.
Yes.
Yeah, hello.
Hello. Hi, Shwani. Yes,
yeah, ma'am. Yeah, ma'am. Can you please share the schedule as well as, I mean, when will the classes will be? Because I think I missed it and it's not coming out on my
Shivani,
Telegram. So.
No problem at all. Shivani, please write it down in the paid Telegram. That, ma'am, I need schedule. Just after the session, I'm going to answer.
Okay, that is a premium group.
Premium is the paid one. Yes, that's not the open one.
Premium study group, no?
Yeah, premium study group. Yes.
And it was coming out to be M2 July. That is the one, huh?
No, Shivani, January 20.
Because I'm not in that group.
Okay, Shivani, drop in a message directly to Safa or me. Okay.
Okay, ma'am. Okay, thank you so much. Thank you.
Thank you, Shivani, my dear.
Take care.
Hi, ma'am. Can I take my question now?
Hello. Yes, please.
Yeah, hi, ma'am. First of all, I'm feeling very confident after listening to your powerful voice and your.
Grateful. Thank you so much. Thank you.
I just want to have a
just pronounce your name for me. Sorry for cutting it. Is it Mena? Is it Meena? Is it
Aparna? I'm Aparna.
Okay, Aparna is speaking. I think Mena was there. All right, Mena, you're also unmute, my dear. Okay, yeah. Okay, I'll take you, Mena, just after Aparna. All right, yes, Aparna, sweetheart. Yes, my dear.
I just want to have the list of books in the decreasing order, like this one to be covered first. If that can be shared on the premium group.
Okay, Aparna, write it down in the premium that, ma'am, I just need the priority wise list. I'll just, after the session, I'm just going to answer all this one by one, okay?
Okay. And ma'am, one more question, like
yes,
the summary have taught us to make from the guidelines. Like, do we have any cooked summaries which can be shared in the premium group, which can save our time?
Yeah, actually the thing is that what I've given the Ala this task and she's doing it for RFA. So her summaries, which basically it's been checked, so I'm satisfied, and that is of the standard. You can use that as the basis, or times. Ala shares that in your group, my dear.
Okay, so that will be sufficient if we are
to make as a baseline, Aparna. But the step number 3 and 4 that you'll have to do later as well. You know, I mean, adding on the books question and marking it and highlighting it. You get it? Yeah.
Okay, thank you so much.
And Aparna, you can also do the website summaries are sufficient as well. So you can also take it as a baseline when you can't read. So then the step number 1 and step number 2, which I did, you can do it this way to make it like a shortcut, and then you can add on points on that. Okay.
Okay, done, ma'am, done. Thank you so much.
Thank you very much. Yes, Mena, my dear.
Are these nice guideline summaries on the website?
Mena, first pronounce your name, sweetheart. Is it Mena or is it Meena?
Minna.
Minna. Okay,
yeah.
Thank you, Minna. Yes, my dear, please. Yeah.
Is the nice summaries on the website are sufficient so that
absolutely
I do not have
sufficient? Yeah.
They are
in fact, they're in detail. They're not missing out any point. Mena, you can take the nice guideline as the basis of that from the website, or from my session, you add points on that summary. That would be a sufficient thing to do. Okay.
Okay.
Thank you so much, my dear. Thank you very much. All right, so we've got a few more hand raising. Harshita, my dear, you want to say something? Yes. Harshita, hello. Hand raised. Hello.
Hi, ma'am.
Hi, this is Gulrukh.
No, ma'am. This is Gulrukh.
Okay, how are you doing, Gulrukh?
Yes, ma'am. Good evening, ma'am. I wanted to ask, Would it be possible for me to join the premium batch? I'm waiting for my results though. Like in August 2nd, the part 1 results will come out.
I've got 100+ students who are just messaging for their school. It's absolutely okay. You can join late, but many of your friends have joined now. The thing is that the more, of course, the guidelines they pile up, the stress is there. Oh my God, they'll be like 1 month they would have covered at that point.
Yes, ma'am. Yes, ma'am. That's what I'm worried about.
Yeah, that's the only thing. And moreover, Safa has got such a soft heart for the part 1 students. She's always Ala also, because she's taking care of you guys in the part 1 group, and she's always like, ma'am, my students, please take them on discount. So they've always been requesting for you guys. So see your ease, my dear, whatever is easy for you. God forbid, if the result would not be on our favor, which I'm sure with Almighty's blessings would not happen. But if at all that would be the case, you can freeze, okay? You can open up your course later whenever you want, all right?
Okay, ma'am.
Thank you so much.
Thank you, ma'am.
Thank you, my dear. My pleasure. Thank you.
Yes, ma'am.
All right, Neelam, you want to say something? Your hand is raised.
Yes, ma'am. Yes,
Hi,
ma'am.
how are
Ma'am,
you
I want to add. Hi, good evening, ma'am. Ma'am, I just want to add on Gulruk queries. Ma'am, I'm also waiting for my result. I am also planning to join on August after result. Ma'am, till then, the guidelines which you are posting on pre-group, ma'am, if we read from that, is that enough preparing for 1 month?
Sweetheart, it's absolutely okay. You can read that, but that schedule is not the paid schedule. My paid schedule is according to my sessions. Right, so that is open group session. So that's what I've given.
So what do you suggest us doing this 1 month so that we will not lag that much behind?
Our own premium part 1 students, many have joined. They joined because they just wanted to start. They've been given this option that yes, they can freeze later. That is one of the option. But if you want to take 1 month, of course, there's some sort of a confusion and anxiety of the result. I can,
ma'am, like if you freeze, then ma'am, what is the rules for freezing this course?
Freezing is that then it would not be accessible to you, and whenever you want to open it up, you can just message and you can open it up whenever you want to take exam. Maybe that July 23 or whatever would be the exam you want to take. Right?
Okay, and that will be, ma'am, 6-month course only, like
6-day course would be shifted to the next one. It would freeze and then it would be shifted to the next one.
Ma'am, suppose if I join from right now and then I get a result, and if it is positive, it's fine.
So but after 1 month, it would, if after 1 month you can freeze it, and then you can open it in January or whenever you want. You can message that my next 6 months course now I want to open.
Okay, ma'am. Thank you, ma'am, for the
facility. Thank you so much. Thank you, Neelam.
Thank you, ma'am. Good night, ma'am.
Thank you, sweetheart. Thank you very much. All right. So we've got other hands raising. Jyoti, you want to say something? Or Tanuja also has raised hand. Or you people?
Ma'am, when are the dates are supposed to come?
Which Tanuja?
Ma'am, exam dates.
Exam date has been decided already, girl.
Ma'am, date in January 23rd.
Yeah, the first week of January. Generally, it's the exam. So I'll still post that in the schedule in the group, right?
Okay.
And the book schedule is different from the schedule of guidelines we are doing.
Mariam, the books are actually cover to cover we are doing. So we can't make a book schedule, sweetie. You get it?
Okay.
It's like cover to cover we are doing.
Okay.
Yeah? Thank you, Mariam. Thank you very much. Mariam, you're same like Sidra's friend, right? Same Mariam, huh?
Yes.
Okay. Sidra today also has shifted to January, my dear. You people, but now I won't shift you guys more than January. Now you people have to appear in January, okay? No more shifts.
In January.
Thank you so much. Inshallah.
Thank you, ma'am.
Thank you, sweetheart. Thank you very much. All right, Shivani, your mic is still unmute. You want to say something?
No, ma'am. Sorry. Okay. Take care.
No worries, my dear. Thank you very much, Shivani, sweetheart.
Meet you on next Sunday, ma'am.
Yeah, next Sunday we are going to have a discussion, inshallah. Thank you so much, Shivani. Harshita, you want to say something? Yes.
Yes, ma'am. Hi, ma'am.
Hi. Yes, my dear.
Ma'am, I just wanted to ask, like, the daily topic questions, usually it will be posted on the Facebook, right, ma'am? Like
both, my dear Harshita. Facebook and Telegram, both.
Yeah, okay. Because currently,
Harshita, the benefit of the Facebook is, sweetheart, that hashtag gives you a some sort
better
of
access.
Yeah, you can just access them even later. In Telegram, if a chat goes up, like it goes up, and you just have to go to the search bar. So both have got their own benefits. So in terms of ease, whatever suits, it's going to be in both of them.
Yes, ma'am. That's what, because Facebook we have not yet started. So
yeah, Facebook will be started, don't worry. Gia posts a question. Actually, before you guys, September exam is also there. So that students are like day and night practicing, they're faster because their exam is like very closer. So definitely you people are just taking a start. So we don't want to bombard you with so many things. Gradually, you people, after 1 month, you people would be faster because you people will understand the things and people would keep on joining and you people will be a big family and people will feel a change after 1 month being supportive and being better in understanding. All right.
Yes, ma'am. Yes, ma'am.
Thank
Sure,
you,
ma'am.
my girl.
And
Thank
also,
you.
ma'am, you wanted me to remind regarding the use of good notes. How to
Okay,
use
perfect. All right, Harshita, good notes. What you have to do is that whatever guideline you open up, the benefit of that is you first go to the good notes and you make your folders, right? You make your GTG folder. In that, you make your nice folder, you make your talk folder. All right. And then you make your query questions folder. When the Telegram questions are being done, you copy paste that question, you paste it in your good notes in that confusion questions folder, and you write your answer. You keep on making your folders like that, right? In GTG, you read the GTG opening in the good notes, it will save in the good notes, and whatever steps I've told today, all the steps, do it there only. What's the benefit, Harshita? This is what I realized because, of course, 5-6 years back when we were reading, these things were not pretty common. In fact, the good notes was like published, I think around 2019 onwards, this appliance get into like very, comfort zone and that of like easily available. So yes. What we were doing, we were making in the notebooks. And when we had to travel, I had to travel for OSCEs in different countries, for the MRCOG and for the MRCP and all. When you are traveling in different places, you have to carry up like all the books and everything. That becomes a huge trouble.
Yes.
The benefit of this is, for example, you are in your operation theater, you've got your iPad in your bag, and you are looking at the Telegram. Immediately, you copy paste that question, you put in the good notes. So that is not done. If at all, it is not like postponed. If at all you're in operation theater and you write it for yourself, okay, I'll go to home and I'll do this in my book and I'll see this question and I'll start writing this question. So that it's not only postponed, there's a chance that you forget as well.
Yes, true.
So it's not that I'm saying that everybody should have good notes, but if somebody is comfortable, there are few people who are not comfortable with the screen, so then they should go with the book thing. But if you're comfortable with the screen, good notes is a very easy way of scrutinizing and making compartments of sections. So that makes it very easy. All right.
But
so
ma'am, in Telegram, we don't have.
Yes, Harshita.
Yeah, ma'am. But in Telegram, we can't copy the. We can't copy the text.
Harshita, you know that which book is being done, right?
Yeah. Yes,
so
ma'am.
you go to that book, open it in the good notes, copy paste immediately. So that 50 questions you should open that. Okay, today these 50 questions are being done. Your book should be opened in the good notes.
Okay, fine, ma'am.
All right, good. Anywhere you're stuck up, I'm really mastered in these tech things. You just tell me in that because I've got all my, folders very organized and all. Just let me know if you're stuck up somewhere, okay? All right.
Sure, ma'am. If you can send me a message, just
send me a message or send me a screenshot if you're stuck up somewhere.
Yes, ma'am. Thank you so much, ma'am. Yeah, ma'am.
My dear Shivani. Yes, we
do. Yeah, from where to get these good notes? You're talking about the good notes.
Shivani, you go to the App Store in the iPad. Right?
Okay.
And download Good Notes, GOODNOTES.
Okay.
So Good Notes is an application in which you can open any folder, any Green Talk guideline, any PDF, but you can mark, you can write, you can add stick-ons, you can copy paste, you can zoom, you can make smaller, everything. Then you can play around the document in the Good Notes.
Okay, so it is kind of PDF, huh?
No, it's an application which gives you a chance of writing, highlighting, scribble,
Okay, to make the notes. That means to make
the notes. Okay. Yeah, but you can open any document from the Google, from anywhere. You can open. When you open into that Good Notes, that basically document opens there. So basically, it's an easy way of studying. Complete folder.
And the MCQs, and the questions.
Everything.
Which will have to do, so it will come in the Telegram as well as on the Facebook on every night, huh?
You can do it night, you can do it morning. If you miss it one day, do it the next day, but do complete them, my dear.
Okay, it will start from tomorrow, then questions.
The question have started since yesterday.
Okay.
Yesterday was the first day. Yeah.
Okay. Thank you, ma'am.
Thank you very
Okay,
much.
thank you,
so
ma'am.
much.
Bye-bye.
Thank you, my dear. Lovely listening to your voice. Thank you so much. All right, Khushbu, you're on mute, sweetie. How are you doing?
Yes, ma'am. Hello, good evening, ma'am. I'm fine. Ma'am,
Khushbu, you're my
actually,
same old Khushbu of July batch? No.
no, ma'am.
Okay,
I'm
you're
for
new Khushbu.
January.
No,
January.
that's perfect. I had two Khushbus earlier. You know that in January and July 2022 as well. So you
yes,
have to
ma'am, I'm
maintain
from
the decorum. Both those Khushbus were very bright. You are going to be equally bright, right?
Yes, ma'am. We'll try. Try by level.
Yes, my dear. Please tell me.
Actually, regarding the notes, what should be the ideal method? Should we handwrite all those notes, or we should digitally save? I mean, in soft copy, we should make the notes.
Khushbu, what is your type? What is your type? What you had been doing earlier? Were you like good in?
I used to write, but later on I realized like it takes so much of my time in writing all those stuff, and
Khushbu,
near the exam I feel like reading it from the printed one only, like from book.
I understand. See, my suggestion is very simple, that if you can write, like for example, students, they've got good memory with writing, right? If you've got a good memory with writing, you can definitely do that. But the thing is that if you think that today I've got less time, so you don't make it a rule for yourself. If you've got a free day and an easy guideline, you can write it down and do it. If you've got a busy day, you take a printout of recommendations and then take a printout and then put the points on that, highlight on that. I mean, the concept is that we should be able to reproduce that. It's not that we should waste time and put a stress on ourselves, right? Yes, so if you've got easy day, my dear, then do it the other way around, like writing it down and then making notes on the highlighting. But if you don't have time, then it's okay. You take the printout, putting in all the recommendations together, following the steps of notes, which I've told you. Step number 1 and step number 2 for that day would be sufficient, because 3 and 4 would be going like side by side. So that would be sufficient, my dear. Okay.
And ma'am, the summary is available on a website portal.
Make it as a basis. It's okay. You make it as a basis. They are much.
All that marking which you mentioned, like that we should mark like
at the moment in the website you can't do that. It is actually on an application they're talking about. That's on the iPad. Yes.
Already marking is there, like it is a MCQ from Brian McGowan or
No, my dear, we can't do that because the summary is from the summary of the guideline. It's not notes. My sessions are going to be full of notes. You'll understand after my session.
And do we need to have a subscription for strategy? Because the Strat Premium group, I was seeing it is from 2017.
No problem at all, Khushbu. The moderators are going to guide. This question is coming up again and again. I'll just guide you in the study group. Don't worry. Okay.
Okay.
Okay. Thank you so much. Thank you very much.
Thank you.
Any other question, please, friends? Dua, you have raised your hand. How are you doing, Dua?
Yes, fine. Alhamdulillah.
That's great to know.
Yes,
Where are
I'm
you?
good.
You know, Khalid messaged day before yesterday. I realized, oh my God, he didn't have the account. So.
Khalid is still in Egypt on vacation. I think that didn't come yet.
I see. All
But
right.
Kamel joined. I think Amro, Ahmed still. I think they are attended the session.
Yeah, that's fine.
I'm got confused, but I understand what you said about the notes, and we have to do the notes and the remarks and the highlighting. This will be the main source of studying.
Yes.
Yeah. So the summary records not enough. Yeah.
Sorry, which is not enough?
The summary records which present on the
summary. Dua, summary would be fine, but if you have time, definitely for first time, I would like you to read the guideline. It gives you an internal satisfaction, Dua. That you have read the guideline, all right. No matter that after reading that, you'll get the same points that is from the summary, but at least you'll say, okay, yes, I've read the guideline. You know,
yeah,
that's just your
main
first
source of studying my notes.
But yes, your notes, or you can take the website summary as a baseline and then you can make notes on that. But the thing is that you should be knowing that what is your baseline. I mean, today, if one green top guideline is being done, if in the revision you have to go back to the main guideline, then your time is wasted. Second time, your notes should be sufficient that you go back to your notes only. Then only the time is saved, right? Got it?
Yes.
So the first time reading should be such a beautiful read that second time you just come to your notes only. If second time again you have to read the complete guideline, then the first read was not beneficial. Got it?
Okay.
Yeah.
Thanks.
Okay. Thank you,
Okay,
Dua. Thank you very much. Thank you, my dear. Yes, Sarah, please. I'm here for all the questions. It's your day to ask questions and my day to answer questions, Sarah.
Hi, madam. How are you?
Hello, Sindhu. Oh, Sarah is here. All right. Hi, Sarah, my dear. How are you?
How are you? I hope you're fine, madam.
Thank you very much, my dear. Yes, please, Sarah.
Thank you. Madam, please, you know that we just finished the part 1, and for me, I just come back from my trip.
Yes.
So I'm a little bit confused about all this. To be honest, I'm not sure to clear because I don't really realize what I have done
It's a very
in the
natural
test.
feeling, my dear. It's okay. Absolutely.
Yes, madam. To be honest, I was a little bit disappointed. I don't know. Maybe I expect myself to do more. I don't know.
this is Sarah's nature, and I know Sarah. I'm sure you'll pass with flying colors, and I know you from very
I
basic.
hope.
Everything would be fine, sweetheart. It's
I hope
absolutely
so.
fine.
Inshallah, madam.
Inshallah, my dear.
Inshallah, madam.
Okay, tell me
Madam,
that you're
please.
free from your trip now and back to now study back.
Yes.
Yeah.
Yes, I'm back home, madam, and I restart working because I just took some vacation, some leave so I can go to the country and to other country and pass my test. So madam, I just wanted to know this part 2. I joined because I messaged Madam Safa and she sent me the link. I joined. I was on my my way back home. I was working, and to be honest, it scared me a little bit because I just
realized there, and that's understandable, my dear. To start with, everybody feels the same, no problem. So I'll guide you. I'll guide you accordingly. I can understand that taking a start is always there's some sort of a transition which student feels from the part 1 to part 2, Sarah. Everything will be okay. So you just drop in a message on Telegram. We'll have a chat at night if you are available, so I can guide you further.
Yes, yes. I just wanted to know, madam, that is that I mean, it seems that it will be a very, very huge.
You can do that in 6 months, my dear.
Package.
You can do that in 6 months. Okay.
Okay.
Okay. All right. Okay.
Thank
you,
you, madam.
so much, Sarah. Thank you. All right. Mina
Hello,
wants to say something else. Hello. Yes. Hi.
Yes. Hi, ma'am. Hello.
It's Sindhu here.
Yes, ma'am. Hi, ma'am.
Hello. How are you, my girl? How are you doing?
Thank you. I love your voice so much, ma'am. Actually, I don't have doubts. I just wanted to speak to you. That's why I called you.
You just joined to listen to the voice, right? Thank you so much. My pleasure, my dear. It's all Almighty's blessing. Okay. Yes, Sindhu.
Listening to your voice, ma'am. Thank you so much.
Thank you so much. My pleasure, sweetheart. Thank you. All right. Okay. Yes, Mina. Thank you, my dear. Lots of love and prayers, Sindhu. God bless you and family, my dear. All right, Mina, you want to say something again?
Yes. Yeah. The questions started yesterday. Is a different schedule from the one you posted earlier on the Telegram group?
There had been, Mina, students actually joined the study group way too early. Now you can imagine that I've got July 23 registrations as well. So according to their hospital routines, according to their commitments, they want to take a start early, right? So the first schedule was for people who had joined around 2-3 months back, January 23. We told them that we'll give them the schedule because they're our responsibility, and they started reading themselves according to that schedule, and we were giving them the guidelines. Now, the final schedule has started, which is module-wise schedule. Now the final study has started. Of course, we had to entertain them because they had joined early, right? Around 150 people, they joined very early, right? So now we are starting the basic schedule, which is started from yesterday. That is what you have to follow now, okay?
Okay, that's the all the question books, right?
Mina, that is module-wise schedule. The book schedule is different, sweetheart. Okay, the module.
Okay, I got confused about this point. That's why I'm asking. So
no. The book schedule is being followed by you guys by September 2022 students. That's being covered up by everyone out there.
Okay, that's which the discussion takes place every day at 4
in the common group. Yeah, that every student is following. That is even the September batch students are following. That's a common schedule of book practice and cover to cover. Okay.
Okay, but the questions started yesterday is module wise, right?
Yes, that's module wise, and that's what you have to follow judiciously.
And
Okay?
it's different from the questions that was like posted earlier every day with a summary.
Every day the module questions would be the same, the discussion would be the same as per the topic, Mina. They would go side by side.
Okay.
Okay.
Thank you.
Thank you so much. Very welcome. Thank you. Okay. Is any other question, please? Jyoti, you have raised your hand, but I'm yet to listen to your voice, sweetie.
Hello, ma'am. Good evening, ma'am.
Hi, good day. Jyoti, you posted certain questions in the introduction. I remember, right? I have to open up that post.
Ma'am, actually all the queries are being answered already because all of them almost ask the same thing.
Okay, that's my pleasure. But I do remember that you wrote 2-3 points in the premium group. I remember I saw them. I said, I'm going to enter. If anything is left, please let me know. I'm definitely going to repeat that for you.
Sure, ma'am.
Yeah, thank you so much. Thank you. Anna, you want to say something?
Yeah, hi, good evening.
Hi.
Hi. So just one or two things, like as we go on, say till November, December, there'll be a lot of more talk articles that will come. So we will incorporate that also in our schedule.
Anna, for example, like the recent talk publication, that's generally not included into the exam. For example, for the April talk publication, I'm not saying to the September students to do that, right? For you guys, we are putting in the April, we are going to just put in, right? So the September one, I would not suggest for the January one. That would be for the July one. So it's okay. We can skip the September one. Until and unless we'll get some very marked change or some sort of a recommendation, we are going to discuss. But side by side, if any update is there, we definitely are going to discuss and we are going to update you guys on that. Okay.
Okay. And as we were speaking, I just downloaded the good notes. So do I need to so do I need to buy the premium version of that, or
no, that's okay. No, that's not required.
Normal,
you guys,
whatever is available.
Yeah, that's absolutely okay. Yeah. If you've got a good memory of your iPad or the iCloud, you can simply just transfer that. Everything for me is like on my iCloud.
So I will need an iPad. Yeah, I can't do it on an iPhone, right?
You're doing that on iPhone. Try that with your iPhone. If you have it.
Okay.
Yeah, actually, I've got Sync with my iPhone, but iPad actually makes you have that pen, right? So how you're going to do it on your iPhone, Anna?
Then I would rather go on a laptop and do it. Then
do that on the laptop and sync it. Yeah, sync it.
Yeah,
that's good.
Okay. Thank you.
Anna. Thank you very much.
Thanks.
Thank you, sweetie. All right. Any other question, please? Khushbu, you're unmute. You want to say something?
Ma'am, one question regarding the schedule. Shouldn't the schedule should be a bit compact so that at least 1 or 1.5 months should be left for revision before January?
It's not like that, my dear. If we are going to bombard you with the guidelines, it would be very difficult to start with because you're taking a start. What we do generally is that after 2.5 months, we start the revision side by side. Because I increased hours, study hours, right? For example, today you are giving me 3.5 hours, Khushbu. After 2.5 months, I would request for like 5 hours. So what we'll do is the 3-hour schedule would go side by side, this gynecology. You will start obstetrics by then, and you will start your gynecology division. This is how it goes. You get my point? So you'll get after 2.5 months, you'll get another schedule, which would be revision schedule. So that will start from the first guideline.
Okay.
All right. Yes, my dear. So 3 revisions are must, and that's what we make you guys do. Okay.
Oh, yes, ma'am. Yes.
All right. Thank you, Khushbu. Thank you very much. Any other question, please? Okay. So are we done with the questions? We've got Vani. Vani, you've raised your hand, my dear. You want to say something?
Yeah. Good evening, Dr. Sidra.
Hi, thank you so much. How are you doing?
So yeah, I'm perfectly fine, and whatever the insights you have given, that they were excellent. And I think that we will do accordingly, and I think we will pass this exam. Thank you so much for the great insights, and your voice is just divine. That's it. It's a healing effect, I think, anti-stress also.
I'm so grateful for that. When I take the booster sessions before that, students, they say, ma'am, we are waiting for your motivation. I'm really glad that if I'm of some tiny help to you guys, I'm not capable at all. It's under my humble capacity, I think, God's blessing. But if I can put you guys to that form and that enthusiasm, I'm really, really grateful that you people have an effect of that, motivation to go forward. Thank you so much, my dear Vani. Thank you. It means a lot to me. Thank you.
Thank you. Thank you, Dr. Sidra.
Thank you, sweetheart. Thank you. Any other question, friends? Thank you very much. Anna, I'm so grateful. Devika, yes, just stick to the timetable and you would be done. People before you, they have been doing it wonderfully. They were just like you, and they didn't have two brains. They didn't have more neurons. They were just like you with the same situation. They were passing from same household, difficult situation. They had difficulties. They had busy days. They had easy days. But at the end of the day, they were successful. So it is doable, friends. It's not something which you are going to get scared of. The first day is the confident start which you people are going to take. And today, if you're going to take the confident start, you people would see that you people will reach to the end with happiness. May this journey be full of unconditional love, burning passion from your side, endless happiness, and may we all begin with a smile and end with happiness from your soul to embrace. Let's take the first step with confidence and let's maintain it till we reach to the end. Best of luck from the entire team of RFA Tutors. Love you all. Thank you very much for being here today. See you guys next week with the first session. I want enthusiasm. I want 100% from your side, and you'll get 200% from our side as well. Bye-bye. Take very good care. See you guys in the study group with all the queries. Love you all. Bye-bye from my side. Thank you.